As with other infectious disease challenges, COVID-19 requires researchers to effectively stratify patients for potential therapeutic intervention and perform appropriate risk assessment. Understanding the effects of age, gender, and comorbidities on the susceptibility, treatment response, and outcomes related to COVID-19 are vital. Metabolomics offers a tool to assess patients that may be most at risk. The following two case studies highlight this solution. Tuberculosis is among the deadliest infectious diseases on Earth. Nearly 1/4 of the world's population are believed to be latent carriers of M. tuberculosis, and currently there is a lack of tools available to identify those patients who will progress to active disease. Metabolomics is often used in biomarker discovery for non-communicable diseases, but until recently, this approach has not been applied in the area of infectious disease. In this study, global metabolomics was used to identify a group of metabolites that could predict progression of tuberculosis. The GC6074 consortium collected samples from HIV-negative individuals who were household contacts of TB cases and healthy at baseline. Samples were also collected from subjects at 6 and 18 months post-exposure. Integrating Metabolon's global metabolomics platform with machine learning algorithms, a panel of risk-associated and disease-associated metabolites were identified. Disease-associated metabolites, such as cortisol and glutamine, were those metabolites whose absolute difference in abundances between progressors and controls increased on the road to the clinical manifestation of TB. Risk-associated metabolites, such as cotinine and mannose, indicate a higher likelihood of progression to TB. Shown here are the metabolites that changed in progressors leading up to tuberculosis diagnosis. Not shown are the area under the receiver operating curves demonstrating the significant predictive power of 10 metabolites to distinguish between progressors and non-progressors. These graphs can be found in the corresponding paper. This study demonstrates the ability of using metabolic signatures to detect disease in asymptomatic patients. This suggests that the metabolic changes that occur leading up to the clinical manifestation of TB can be harnessed to identify those patients most at risk of progressing to the clinical TB. Furthermore, this consortium consisted of 4 different collection sites across Africa, providing evidence that this metabolic signature is applicable across lifestyle, genotype, and collection differences. Upon further validation and refinement, a targeted metabolite panel that can be performed routinely could be created. Metabolon's targeted assay team can help customers develop such a panel. Identifying high-risk individuals using this blood metabolite panel could provide enormous value both in recommending therapeutic strategies and in reducing costs of conducting clinical trials that test new treatments and interventions. Additionally, subclinical signatures from a blood sample can aid enormously in controlling an active pandemic. One of the challenges that has arisen with the COVID-19 pandemic is the lack of risk mortality information and patient stratification strategies, particularly in the elderly population, where hospitalization, ICU, and case fatality rates are higher. Low-grade chronic inflammation has been associated with many diseases of aging, but the mechanisms responsible for producing this inflammation remain unclear. Inflammasomes can drive chronic inflammation in the context of an infectious disease or cellular stress, and they trigger the maturation of interleukin-1 beta. This group set out to investigate the role of inflammasomes in the context of human aging. The Stanford Ellison longitudinal cohort was used to combine gene expression with metabolomic data to understand inflammasome activity in vivo. Subjects greater than 85 years of age were assigned into inflammasome module high, or IMH, or inflammasome module low, or IML, groups based on age-related gene expression. These gene expression groups also demonstrated differing metabolic profiles and outcomes. Those with constitutive expression of IL-1 beta nucleotide also exhibited nucleotide metabolism dysfunction, elevated oxidative stress, high rates of hypertension, and arterial stiffness. Those without constitutive expression of IL-1 beta lacked these characteristics. Adenine and N4-acetylcytidine, both nucleotide-derived metabolites that were detectable in the blood of the IL-6 beta expressing group, were then found to prime and activate the NLRC4 inflammasome, induce production of IL-1 beta, activate platelets and neutrophils, as well as elevate blood pressure in mice. These data suggest that the metabolites play an active role in promoting systemic inflammation. Furthermore, in individuals over the 85 years of age, the elevated expression of inflammasome gene modules was associated with all-cause mortality. Thus, targeting inflammasome components may ameliorate chronic inflammation and various other age-associated conditions. A very interesting finding of this study is that the metabolites not traditionally linked to inflammation may be more closely associated to inflammatory responses than originally thought. This raises the possibility of using these signatures as measures of the inflammatory response. More studies investigating the link between metabolites and inflammation are certainly of research interest.